Well, welcome, folks. Welcome to today's meeting. Please, if we can go to the next slide. All right. So I want to put some context into this H5 outbreak that is currently ongoing. First, I want to point out that this virus, this particular subtype, the H5N1, has been identified since 1996, and we've been tracking it ever since. It was first detected in southern China, and this clade 2344B virus that is implicated in the current outbreak really emerged in 2020 in wild birds. It really has been unprecedented how this virus has spread globally. From its first detections in Asia, now it has made its way to North America as of 2021, mostly in birds, in wild birds. That has spilled over into poultry. In 2022, we had more than 1,000 flocks that have been affected, more than 99 million birds in 48 states. And then, of course, now in 2024, we have the spillover of those viruses from birds into livestock, into goats and dairy cattle, and then some other mammals too, raccoons and skunks and foxes and whatnot, cats as well. And so just a lot of spread, mostly again in birds, which is there where the typical reservoir of these viruses. Next slide, please. Great. And so to put these into context, how this year compares to previous years, right, because we've been tracking this since '96, this year has been a robust avian influenza season, but not more so than previous seasons. And so, for example, I just want to draw your attention to 2003 to 2015. We had a big period of epidemics during the Northern Hemisphere winter, and where we had a lot of cases in some countries. And so, for example, 2015, which is that big bar there that you see in peach, there was hundreds of cases in Egypt, for example, in Cairo. In a similar situation to what we're seeing here in the US, where there was spillover of avian influenza H5N1, mostly in birds that had, wild birds that had then gone to poultry, and then from these domestic birds into the people who took care of the birds. And so it's not uncommon for us to see these spillover events into humans from the birds. Next slide, please. All right, so a couple of things to note. I think that most of the exposures that we see for H5N1 among humans are really because humans had direct exposure to sick or dead birds, to sick or dead animals. So most of the times when we ask questions about, oh, what might have you gotten infected from, it's really because they were exposed to these infected animals. And now we see that there is that direct exposure to dairy cows that are infected with H5N1 among people who are not using, particularly among people who don't use personal protective equipment on a regular basis, has also put them at risk for becoming a case of H5N1, a human case of H5N1. Now, what is very, very important to note, though, is that despite the amount of avian influenza H5N1 in birds in the US, and now the spread in dairy herds, there has not been human-to-human transmission of H5N1, sustained human-to-human transmission. Sometimes there's a one-generation transmission from one person to the next. Who, for example, if you have a sick person who is being taken care of by a family member in places like Asia, that's really common. You can see one jump from one human to the next, rarely to a second generation, but it's still very uncommon, and the virus has not adapted to spread efficiently between humans, which is really critical for us to determine if this is a virus that poses a imminent pandemic risk. It has not happened. And we haven't seen human-to-human transmissions in the US in this current outbreak either. Very important to know. Next slide, please. All right, so you may be wondering how is it that you get exposed to avian influenza from birds specifically? Like not just you were around sick birds and you got sick, but what happens specifically? And many of you who work with poultry know that birds are they are often covered in dust. And that dust can have their feces, can have some of their excrement, and the excrement is where a lot of the virus lives. And so, for example, if you're taking care of birds and you are not wearing personal protective equipment like a mask and goggles, etc., and you walk into a hen house, and the birds are flapping their wings, they're aerosolizing all this dust with feces that may have viruses, and people can get a coating on their face and their eyes and their nose, and that can sometimes cause these infections. The other thing that we believe is that when people touch contaminated surfaces, like if you work in a live bird market, for example, and it's not typical in the US, but in other countries, and then you touch your mucous membranes, your eyes, because your eyes are itchy, or your nose, or your mouth, then you can become infected with avian influenza viruses. And so hence, we caution people who work with poultry to avoid touching their mucous membranes, their eyes, nose, and mouth, and also to wear personal protective equipment, because it decreases the risk that they'll have a direct exposure of the virus in those areas that where the virus can latch on and then infect the person, and also prevents them from touching their eyes and whatnot directly, because there's actually something, a physical barrier in between your eye and your hand, which may be contaminated from touching surfaces where the birds have been pooping on, for example. Next slide, please. All right, so let's talk a little bit about the current situation. So all that was a background. Many of you know this if you work with poultry, that you're intimately familiar with avian influenza viruses and the risks that they pose. And so let's talk about now the cow situation, what is happening with cows. And so next slide, please. All right, so since March 2024, USDA had confirmed avian influenza viruses in dairy herds, and now this is spread to 13 states, more than 160 farms that have been affected by this H5N1 outbreak among dairy cattle. We're still talking about the clade 2344B virus. This is really important. This is not a new virus. This is the virus that we've been tracking since 2020. And we find that the dairy herds have very high levels of virus in raw milk. And so we believe our USDA colleagues have noted that their primary hypothesis for what has happened this year is that avian influenza spread from wild birds to domestic birds and then to dairy herds. And it is possible that the cows were exposed to surfaces that were contaminated by birds, the birds' poop, of course, and the viruses are in the poop, something of the sort. And then the spread occurred within the herds, the dairy herds specifically. And so it's a spillover event, not unlike what we've seen from birds to other mammals in previous years. The new thing here is that it's dairy cattle in the US, commercial dairy cattle. Next slide, please. All right, and so as I mentioned earlier, it's not just dairy cattle, of course. We're also, our sister agencies are also tracking the H5N1 spread among other mammalian species, and from wild birds to cats, for example, barn cats or raccoons, possums, foxes, striped skunks. In other parts of the world, there's additional spillovers into other kinds of mammals, like for example, in Europe, Northern Europe, into fur farms, and it's an important issue for them economically. And so we see this transmission, but the important thing to note is that this particular virus is not well adapted to transmit among humans. And so because of the way that the virus latches on to the respiratory cells, It is most adaptive to transmit among birds, and there's some sporadic spillover into mammals, but not efficient spread between mammal species, beyond what we see, for example, in dairy herds, which is, I think, a combination of different factors, including the fact that they're in herds and in kind of special environments. And I see there's some questions coming into the chat. We'll try to get to those a little later after the chat, after we present, just in case that they're answered in the PowerPoints. Okay, next slide, please. Right, so thus far, we have 11 cases that have been officially reported. The first case of avian influenza H5N1 in the US was April 2022, a case in Colorado, again exposed to depopulation of a poultry flock that was infected by birds. Then many of you have seen that there's been additional cases in Colorado, again from infected poultry flocks. 6 cases that have been reported, and then the cases of humans that are exposed to dairy cattle. And so we had first a case in Texas in April, then we had 2 cases in Michigan in May, and then 1 more case in July from Colorado. And one would reasonably expect that there could be additional cases that accrue during the coming weeks as investigations continue. And why is this? It's because as long as we have avian influenza infected domestic animals, then the probability of their human caretakers getting infected remains, particularly if people who work with these domestic animals are not wearing personal protective equipment and therefore can get more readily exposed to the viruses and become cases themselves. It's also important to note that the cases thus far in the US have been very mild, and this is really fortunate. Unlike the cases that we saw in Asia, for example, early on, where the case fatality proportion was high, the cases we've seen in the US have been mostly mild cases, mostly conjunctival, eye symptoms, eye redness, watering of the eyes. In the minority of cases, there's been some very mild respiratory symptoms, nasal congestion, sore throat. But for the most part, mild cases, none have required hospitalization. Cases have been offered antivirals, I'll talk about this in a second, and have been treated effectively. And this is all important and good news for the US. Next slide, please. All right, so what do we recommend? We saw some questions, some preview questions from participants about how folks can protect themselves. And so it's important to think about how is it that people get exposed to viruses in the context of this outbreak in dairy herds? And so not unlike the situation with poultry farms, you can get direct exposure to the viruses where it's highest in concentration. In the case of dairy herds, it's not the poop like in birds, it's really in the milk, in the dairy herd's milk, where the influenza virus concentrations are very high. And so many of the cases that we've seen in this particular outbreak, they have reported to their state jurisdictions these narratives where, for example, they got squirted in the eye with milk, or they had wet hands from the milking process, and then they touched their eyes. And therefore, that direct exposure from contaminated milk it seems to be the most common way why people get infected. And this is important because personal protective equipment that protects you from getting splashed with milk or getting contaminated hands from touching your face while you're working until you get a chance to wash your hands, all those things are important in clues about how we prevent it. So again, personal protective equipment being key to the prevention of avian influenza spread among people who work with potentially infected herds or flocks, for that matter. And I saw some questions about, it's summertime. What about PPE in the summer? And we'll get to that in a little bit. Next slide, please. All right. So we've also been doing some additional sleuthing beyond the outbreak response to understand what is the risk to the general public and to dairy workers from this H5 virus. And so one of the things we've done is called a seroprevalence study. So basically, we've taken folks that work in the dairy industry, and we have tested their blood to see how many of them had antibodies against this virus. And that tells us if that person had been previously infected with avian influenza and perhaps didn't know about it because either they had no symptoms or they had very mild symptoms. And what we're seeing is that there seems to be no antibodies present in the people tested for avian influenza H5N1. And this is really important because it tells us basically that what we see with the infected cases may be what is important to track rather than having this large volume of people that are walking around infected with H5N1 but asymptomatic. That's important than how we track this outbreak. And it also tells us about how we need to work to prepare should this virus change over time. How might we protect communities moving forward? Next slide, please. All right, so let's talk about what people can do to protect themselves. There are things that people can do to protect themselves, and we want to, and I thank you in advance for helping us propagate these messages to the people that are most affected, which is those who work day in and day out with poultry flocks and dairy herds that might be infected with avian influenza. And so the first thing is that the H5N1 is really high in concentration, again, in the raw milk of dairy cows. Also in lung and muscle and other tissues of cows that are infected and often ill. And so what a worker can do to protect themselves from getting ill is to wear personal protective equipment. And it's very important when working with infected dairy cows, and also very important to avoid drinking raw milk. And so I, for example, I grew up on a farm, and many of you may relate to the story, having uncles, for example, or cousins that say, "Oh, you should taste the raw milk. It's great. Here, have some raw milk." And that was, 40 years ago. Now we know quite clearly drinking raw milk is not a good idea. Not a good idea because raw milk can contain all sorts of pathogens that can make you sick. And so not a good idea to drink raw milk. And it's certainly not a good idea to drink raw milk with the intent to develop antibodies against H5N1. That is not a good idea either. So please, if you are in communication with people that may be tempted to drink raw milk, let them know that it is really not a good idea, especially in the context of an H5N1 outbreak in the community. Now, a lot of the materials that we've provided, that we developed in consultation with the states and with other federal authorities are now in English and Spanish and Quiche and in Nahuatl, which is the last two are the Mayan and Aztec derivative languages that millions of people speak in Central America and Mesoamerica, and are often the people who take care of these flocks and dairy herds in the U.S. And so we really want to get the word out in the language that people understand, make sure that they can protect themselves. Again, not drinking raw milk, wearing personal protective equipment, those sort of things can basically save your life. Next slide, please. Okay, and because not everybody is comfortable reading material or listening to radio messages, we have a lot of radio messages, for example, that we're putting out to local radio stations and to other broadcasters. Some people are visual people, and so we've also worked to get infographics about what kind of personal protective equipment is recommended by our sister federal agencies for the prevention of the transmission of avian influenza from environmental surfaces or from infected animals, so that they don't become cases. And you see here very clearly that, overalls, gloves, masks, boots, etc. Now, for those of you who worked on a farm, it gets hot in the summertime, and it's dusty, and sometimes it's an added consideration to have to wear personal protective equipment. I personally I attest to that, but nevertheless, one of the most important things people can do to protect themselves in the context of an outbreak. Next slide, please. All right, so again, infographics about the importance of not drinking raw milk. This is we need to stay current with the times. So there was a lot of things we didn't appreciate perhaps about the risk of drinking raw milk back in the day, but certainly now it is important not to drink raw milk. Pasteurization, fortunately, kills a lot of the pathogens. Pasteurization was, of course, originally designed for killing bacterial pathogens, but we now also know from a series of studies that have been done recently that it also kills the H5N1 virus in milk. It makes it safe to drink the milk. So please communicate this message to your constituents, if you will, and so that we can protect our communities together. Next slide, please. All right, one more, please. All right, fantastic. Now, you may be wondering at this time, what should you be looking for? If you've been exposed inadvertently to, you or your people have been exposed to an infected flock or an infected dairy herd, what should you be looking for? And you should be looking for the following symptoms. Those of acute respiratory infection and conjunctivitis. And those are basically feeling feverish, having a sore throat or a cough, nasal congestion, maybe having nausea or fatigue or muscle aches, infrequently diarrhea, but sometimes a thing, particularly with kids. Shortness of breath is really quite a danger sign, and if you're getting shortness of breath, that's already a sign that you may be not just calling your local health department and doctor, but you may actually be going seeking urgent care. And then, of course, the new thing to remember with avian influenza viruses in particular is the conjunctivitis. So the eye redness, the inflammation of the conjunctiva, eye watering, etc. That may be one-sided or on both sides for both eyes. It's very important to keep that in mind. Next slide, please. Now, what if you develop symptoms? Then it's really important to seek medical care right away and to seek testing and to notify your state and your local health department to help you navigate the testing and maybe even access to the necessary antivirals. Really important to remember, there is treatment for H5N1. There is treatment. It's effective treatment for H5N1. And it's key to take it as soon as possible after you recognize that you have symptoms, because every hour counts for antivirals. Unlike antibiotics, where you could maybe be several days into your illness and still get good effectiveness from your antibiotic, antivirals really are best when they're provided right away after you recognize symptoms. Really within the first 48 hours is when they're most effective, but every hour counts. And so if you recognize you have symptoms, call your medical provider right away, let your local authorities know, and then they can provide you antivirals, empiric antivirals, and simultaneously do testing for you to swab you and then give you antivirals so that you can be treated for H5N1 should you have it, and B, we can also confirm that you actually have H5N1 and not something else that causes similar symptoms. Next slide, please. Okay, there was a question in the in the material that you sent forth when you registered about whether there was testing available, and there is testing available for this particular virus. The kits that are provided to national influenza centers from across the world, including Canada, what the state laboratories use, and Mexico, they are effective for picking up this virus through molecular assays. And so what typically would do, they would obtain a swab of your nose and throat and maybe even the eye if your eye is affected, and then they would put it in a little tube with viral transport media, a little liquid, and then they would send it off to the state lab, and then the state lab would say whether they found H5N1 or not, and then they would send it for confirmation here at the US CDC in Atlanta. And so there are tests that are available. And I understand too that the future may hold additional testing capacity for folks in different locations, but right now that's what we have, and it's really it's highly accurate. The second thing is that, again, to underscore, there is treatment for H5N1, and so it's important not to wait and to get treatment right away. Pair treatment, to be very specific. Even before you get your laboratory results, you should already be on antivirals. And part of the reason for this is that it decreases your probability of progressing into severe illness. So you may have start with conjunctivitis, a little sore throat or whatnot, but if you don't treat it, some people progress into worsening disease, shortness of breath, their lungs get infected, and some people even die. So we had a lot of cases die in Asia with H5N1 early on from exposure from birds to humans. That has not been the case, fortunately, during this particular outbreak in the US, but we don't want to go there. So please avail yourself of treatment. And then, of course, we also ask people to isolate themselves at home. This means that if you have mild symptoms, stay home and well in a room by yourself. That way you don't spread the disease around to others. Local jurisdictions are really in charge of management of cases, but that's the guideline right now. Next slide, please. Okay, so the other thing to remember is that if a person is confirmed with H5 illness, then we also need to think about the people who are in proximity to them. So say, for example, that I've been working on the farm and I get sick, I develop symptoms this morning, and I'm wondering whether I have H5N1. Not only do I call my healthcare provider and I let the state folks know that I may have H5N1, but on top of that, I had to worry about my spouse, for example. If you sleep in the same bed, for example, it's easy to you're such close proximity. It's you can transmit it. You're touching surfaces. You're sharing utensils. Who knows what you're doing in the household, and therefore you can make your household members sick. And so it's important that they also be provided prophylaxis, which means that it's you're given antivirals, also oseltamivir in this case, at a treatment dose for this particular virus, so that you don't develop illness. And that's really important, that not only we have to think about protecting the people who are infected and ill, but also those who may be exposed and may become ill. And the same applies for those who are working in an infected herd, weren't wearing personal protective equipment, haven't developed symptoms yet. They may elect, in consultation with the local jurisdiction, to get prophylaxis to make sure they don't get sick. And this, I believe, for example, some of the states during this outbreak have chosen to do that with some of the people who were exposed and hadn't become sick yet. Next slide, please. All right, just to put things into context, not only are we partnering with your local authorities, your state epidemiology folks, to track these outbreaks, to better understand what is happening in the context of an infected dairy herd, and the humans who may have become ill because of working with these infected animals, but we also track a handful of other types of surveillance systems, which really amounts to tens of thousands of tests for avian influenza in the US during this time period. And so, for example, 34,000 tests since February of 2024, just trying to track this disease everywhere in the country. So we look at samples from hospitals, we look at samples from emergency departments, we look at laboratory specimens, we look at syndromic data, and we look at wastewater, and among other things, to determine if we see any signals that would suggest that somehow there are more cases than we think there are. And so from the human side, a lot of testing to try to determine that we are still talking about an outbreak that is almost entirely among birds, and then these infected dairy herds, and with some very infrequent spillover into humans. Next slide, please. Okay, so to sum up, not to take a lot more of your time, we believe all this information that is coming in from the outbreak investigations, from the seroprevalence studies, from what we know from the history of this, the past several decades of tracking this H5N1 virus, And what we're seeing from our surveillance systems, we really do believe that the risk to the general public is low. The risk for the general public is low. Nevertheless, the risk to those who work with infected animals or contaminated environments, either occupationally because that's their job, or because they're doing it recreationally, like if they're in 4-H or some other, they raise domestic animals for recreation, the risk is higher. And so for those individuals, please, it's important to do due diligence, to wear your personal protective equipment, avoid exposures unnecessarily. And then if you become exposed unwittingly without wearing personal protective equipment to flock that you later learn is infected, or dare herd that you learn is infected, that you track your symptoms for 10 days after last exposure to make sure you don't develop the symptoms that we talked about, the conjunctival symptoms of the eye, the nasal congestion, the cough, etc. Because if you do, then it could save your life to call your provider right away, get antivirals, oseltamivir specifically, and to get tested simultaneously, and then and to isolate yourself, and to also make sure that your household members and or those who are in close contact with you also get prophylaxis. Next slide, please. And because you may have very specific questions, you may be a healthcare provider, you may want to know about dosages and whatnot, here our colleagues have provided some very specific links that has additional information. Next slide, please. Okay, thank you very much. And we'll take a look at the questions here on the chat, and so that we can start to answer them together. Thank you so much.
We're actually going to go to our OSHA speakers. They have a time constraint, so we'll let them speak and we'll circle back, because I know there are a lot of questions. So Linda Ruth and Sandra Bulish, if you guys would like to get started, thank you.
My name is Elizabeth Linda Ruth. I am the area director for OSHA, and I'm going to go off camera here for just a minute. There we go. So my name is Elizabeth Linda Ruth. I am the area director for OSHA, and I definitely want to thank you for putting on this presentation today. I think it's important that we get this message out on how we can protect workers that work in the animal production area. Did the slide advance?
Not yet.
Not yet. There. OSHA, our mission is to protect the American workers that are out there working every day, and we want to make sure that employees have a safe and healthful working condition. And by when I do say Americans, I want to make sure that I do stress that it means everyone who's working in America, regardless of your background or your country of origin. So I definitely want to make sure that your rights are protected as well. So most of us think of OSHA with our enforcement. You hear that OSHA comes out and they conduct inspections, but OSHA reaches its mission also, but by providing training, such as the event we're currently on. We also come out and assist employers through outreach efforts. So there are other means for OSHA to ensure that employees are provided a safe and healthful working condition environment. Now, today we are here to talk about the H5N1 virus. It's also called avian influenza, the flu, avian flu, bird flu. And so we've already heard and we received a lot of information from our first presenter. So some of this stuff may be a little bit repetitive. But as you can see, as he mentioned, it's more than just cattle. It does infect other mammals, red foxes, skunks, dairy cattle, and of course, poultry. And so here in Texas, we did have the contamination in dairy herds. So that is something too that we are aware of. Um, as I mentioned, my name is Elizabeth Ruth, and I'm the area director for OSHA, and I'm located in Lubbock, Texas, which covers up to the Texas Panhandle and down towards the Pecos River, including Midland and Odessa area. And we do have dairy and cattle producers in our area, so we are aware of these hazards, and that's what we're doing here today. We want to make sure that we raise awareness to protect employees that could potentially be exposed to H5N1 virus. We talked about the people who could potentially be exposed. We have people that work in poultry, cattle, that work with livestock. We've heard today about how this virus is in raw milk, and we've also heard today a lot about personal protective equipment as well. So I'll dive into that a little bit later in the presentation. Now, exposure, I mean, that can occur from even touching contaminated surfaces, other materials, and it can enter through your nose, mouth, or eyes. And we have learned that the virus can stay on surfaces for a duration of time, and that's based on factors such as temperature and humidity. So we want to make sure that when we come in contact to surface areas, please be aware that this influenza virus can survive on surfaces for a longer duration of time. We've seen some stats, and these were just some stats that we pulled from CDC. Clearly, we've heard some very specific stats, and we too want to report the number of human cases, which is 11. In the United States, we've got 4 in the dairy industry, and then about 7 in the poultry industry. And so, as we've seen the various stats that we've heard earlier today, I won't go over those. Now, what is OSHA doing about the influenza? We are trying to make employers and employees aware of the hazards associated with the H5N1 virus. And we have recently put out a hazard alert, which describes, gives a little bit of background, identifies some of the workers that could potentially be exposed, and some of the mitigating factors that we can do to avoid getting H5N1. And so this information is available off of our OSHA website. OSHA has also put together some additional information in what we call little quick cards, and that information we can share with the employers, employees. That too is available on our OSHA website as well. Employers can order some of these placards through the website. The information talks about, again, precautions that employers can take. It talks about some basic controls that the employer can implement. These cards come in a variety of languages as well. So we think it's important that we share this with the public, including employers and the workers that are potentially exposed to avian flu. Again, this information can be found off of our OSHA website. And again, it's also specific to the type of work that's being performed by the workers. So whether you're animal handler, just general precautions, those employees that work in the poultry. So they are very specific. to the environment that employees find themselves in. Now, we at OSHA, now what can OSHA do out at your facility? So OSHA does not have a specific standard that covers just the avian influenza virus. However, we do have what we call the general duty clause. So under this specific act, the employers must provide employees with a environment free from recognized hazards that are causing or likely to cause death or serious harm. So, in the event OSHA does come out to your facility and has to do an enforcement action, we have standards that we can enforce. We also rely on some of our existing standards, such as our for uh, general requirements for respiratory protection, sanitation. We have the bloodborne pathogen standards, HAZCOM standards. So there are several standards that we can enforce to ensure that the employer is doing the correct thing and protecting its employee workforce. Earlier today, we did hear some about some of the signs and symptoms. And as an employee, we want to make sure that if you're working within this industry and you find yourself with some of these symptoms, it is important that you notify your employer and you want to ensure that they're aware of it in addition to seeking medical care. So these are the signs and symptoms if you're suffering from fever, sore throat, and of course, eye infection, pneumonia. Now, how does this differentiate from, someone who may have allergies or something like that? Keep in mind that at this time, we are trying to address those workers that are at a greater risk of of being exposed to avian influenza. So that's where I say, we need to reach out to the employer and let them know specifically if you're one of those workers that work in this industry. Now, as I talk to the employers that we have with us today, I want to talk to them about doing what we call a hazard analysis. And that is, we go through an exercise where we're trying to identify the risk of exposure to our worker population. We want to consider what the operation is, specifically the task. Is there a possibility of splash? Does my employee need gloves? Do they need aprons? Do some need goggles? Those are the things that we want to consider when we're doing a hazard analysis of the work that's being done at our facilities. Now, what can we do as employers? We can take certain engineering controls, something as simple as erecting a barricade if it's possible, you can erect an acrylic barricade. Those are some things that we can do engineering controls. We can also do some administrative controls to limit the exposure to surfaces and other contaminants by, training employees on how to handle certain how to perform certain procedures. So these are kind of some of the things that fall under administrative controls. We can implement safe work practices on how we do the tasks that are being performed. And then finally, and very important as well, is of course is our personal protective equipment. We've been talking a lot about that, and earlier today you saw slides that contain, aprons and boots and Tyvek suits and things of that nature. So that is something that, employees should be afforded um, at no cost to the employee. So I do want to stress that. If you feel that your employer should be providing you some of this PPE that we've been talking about, in a couple of slides, I'm going to discuss what you can do if you're not getting the PPE that's needed at no cost. The other thing we want to do is
Linda, I'm so sorry. I'm going to briefly interrupt. Just there's a bit of a time check, and so I don't know if you could summarize the next few slides in the next 5 minutes or so. That would be really helpful. We want to make sure to address folks' questions.
Okay. So thank you. I'm currently on the training slide. So we want to make sure that employees are being trained with what's going on with avian flu. We want to make sure that employees are being provided their PPE. And because of our time constraints, I definitely want everyone to know that you have rights regarding filing a complaint with OSHA. You have the right to work in a environment that's free from any safety or health hazards. So please, if you feel when calling OSHA, your information is kept confidential. So you do not have to reveal your name. And you also have the right to contact OSHA without any form of retaliation. So if you feel that you voiced your concerns to your employer, to OSHA, and perhaps you're being retaliated, please know that we can assist you with that as well. Uh, a couple more slides. This information can be found on our OSHA website. You can call OSHA. You can file your complaint online. You can send a letter to our agency to discuss those complaint items that you have concerns. Please be prepared to talk about why you're calling OSHA, the name of your employer, the address of where you're currently working at, because OSHA does have jurisdictions, and so we want to make sure that we route your call accordingly. This information can all be found online. And again, I do apologize for the technical difficulties that I had today, but please, if you have some questions, would like to file a complaint, please visit our OSHA website. And here on the screen, I have the OSHA Lubbock area office. My name is Elizabeth Ruth, and you're welcome to email or call me directly if you'd like some more specific information. We do have a compliance assistance specialist. Her name is Crystal Fuentes Cruz, who can aid in helping with providing you additional information. Thank you, Bethany.
Thank you. We'll go ahead and jump to Sandra's presentation. And I know it hits on Hannah's question that she just put in the chat.
For time, just go ahead and pull up my presentation. I don't want to do the same thing. Okay, this is OSHA, so next. And I'm Sandra Boulash. For the time we're together today, just call me Sandy if you want to, because Boulash is kind of a hard name. I'm a labor liaison, and what a labor liaison does is we like to think of ourselves as compliance assistants for employees, employee groups, both unionized and non-unionized, cost groups, worker advocate groups. So I'm located in Dallas, Texas, but I'm all over the place online. So next. This is my disclaimer saying that I'm going to try to give you pretty good information today, but I cannot give you total information at the time that we have. So be kind to me. Next. And our objectives today, I want to talk a little bit about OSHA's jurisdiction in agriculture. I'm going to buzz through employee rights a little bit and talk about the complaint process. And if we have time, might dabble into the 5A1 general duty clause. Next. So let's talk about OSHA's jurisdiction and how it can get complicated. Every year, Congress authorizes budgets for the government, all the agencies, including OSHA. And along with our budget, they will sometimes put in it. Well, that's called appropriations. So they also put riders in there. And a rider is specific information, instructions about how we are supposed to use our money and not use our money. So we must spend our money as instructed by Congress. And our Appropriations Act, you'll see the link down there. You can go to it on our website and find it under that admin 2-170. Next. Excuse me. There's a small employer exemption in the Appropriations Act, and it does include farming operations. So for a small farmer operation to be exempt, of course, they have to be a farming operation. The ands are really important here. All these ands must come together. They've not had more than 10 employees at any time during the previous 12 months, and they don't have an active temporary labor camp now or any time during the 12 months. And the 12-month is, that time period is looking back when we were made aware of something. And so we're counting back from the time we received notice that there could be a problem. Next. If the small exemption applies, then, you know, the employer is exempt from all of OSHA enforcement activities. We're also prohibited from seeking them out to provide compliance assistance to them or outreach activities. And so for the dairy, cattle, and milk production, this includes the NAICS code. I don't know if you guys probably know that all industries are assigned a classification number. The one for dairy operations is 112120. There's also some poultry operations that are also in that 112 categories, such as hatcheries and things like that. Although services for chicken catchers would have a different NAICS code, they would be 115. So we'd have to study the Appropriations Act to decide if we have jurisdiction or not. Next. Now there's another part of it, low hazard agricultural employers. You have the same criteria. It has to be 10 or fewer employees currently in the company, and that does not include family members. This would be people that the employer hires to work besides their family. And the NAICS code would be on the table in our Appropriations Act, and that table changes from year to year as the BLS averages come out to determine whether or not it's a low hazard industry or not. And the cattle operations that we're most interested in is not on the low hazard industries table. Okay, next. So if an employer is not exempt, then we can go in and conduct inspections if we need to, and pretty much do standard OSHA work, except for considerations of field sanitation and temporary labor camps, restrictions that might be included in the appropriations directive. And again, you know, you can find the directive on our website. See down the link below in the teal green. Next. So if your employer exempt, you think, well, OSHA's not going to do us any good. Well, actually call us anyway if your employer is exempt, because we can provide information to you about avian flu and means to protect yourself.
Good. How about you?
Well, and on. So you can contact, you see that online, or you can call your nearest OSHA information. We can always provide information to you. CDC will also have information, as we learned earlier, and we try to maintain consistency between OSHA and CDC the way we're putting our information out. And your best bet is tell the employer if you have concerns, safety and health concerns, because I've inspected a lot of small employers over the years, and they often become a tight-knit group and they want what's best for their employees. It's certainly worth a shot. Next. So this is where we have jurisdiction. Next. Okay, these are the employee workplace rights that are on the OSHA poster, basically, and they're all listed here. And Ms. Ruth covered those earlier. You have the right to go to work and come back in the same condition when you come home. Know about the hazardous chemicals. You learn about hazards and, and on and on. Let's just go next. But that's kind of been covered. And that was covered also. What I want to highlight here are the time deadlines. To file a safety and health complaint, we have to have notice of it. It has to be within the past 6 months. If someone calls and wants to file about something that happened a year ago, we can't address that. On the whistleblower complaint for retaliation regarding safety and health and OSHA, that timeline is 30 calendar days and it is firm. So whistleblowers, they enforce something like 22 to 25 statutes, but the one that we are interested in is that 30-day timeline. Next. Okay, and again, so if you can't work it out with your employer, contact OSHA. You can contact the regional office also, and we will send you to the correct area office where the area office that has jurisdiction. Next. Anyone can file a complaint, and if they believe that there are concerns or they know the standards and there's a violation there, they can request to file a complaint and not have their name revealed to the employer. And you have the right to know what the results of any action is that we take, either an inspection or an investigation. Next. And anyone really can file a complaint, but we really prefer that employer or employee representatives who know about current hazards are the ones that will be filing. If you're a family member filing for another family member who works for a company, we would like for you to at least tell the employee that you're filing on their behalf. Next. We have two types of complaints, the formal and inquiry or non-formal. The formal results in an inspection, and that's going to be someone who is a current employee or a representative who sends us a written request and their signature for an inspection. The other one, the non-formal, does not result in an inspection, but sometimes a lot of people, complainants feel like there doesn't need to be an inspection if it's just brought up to the employer's attention. They will go ahead and make corrections, and we can actually get a lot of results out of a non-formal process. Next. You can file online, and let's go to the next slide because I can show you how to do that. Okay, this is a screen of our website, what it looks like. So I have, once you go to the main OSHA page at www.osha.gov, this is what you're going to see. Note in the upper right-hand corner, there's a search box. And just to the left of that, there's languages circled in green. If you need a language other than English, a drop-down menu appears and you can select your language. And it translates the web pages for you. The A to Z index is really useful. Click on that, you'll see an alphabetic scale appear, and you can just choose the first, like R for record keeping, for example. Under help and resources, that opened up that box for you, that drop down, and it goes to again to file a complaint or publications. And another way to file a complaint is under that drop box, you'll see take action. Below that, file a complaint. Next. Besides filing online, you can just download the form Complete it at your leisure and send it to us by fax, mail, or email. Next. You can call our office, talk about it, because maybe you're not sure you want to file a complaint yet. If you file it over the phone, we're going to give you a few days to get to us a written request, a statement that you are a current employee or a representative, and that you want an inspection and you signed it. That makes it formalized. Next. And you can also come see us. We always are. Standard hours are 8 to 4:30, and we always have someone there to receive visitors. Next. Do you really have to identify yourself? Well, you really don't even have to identify yourself to OSHA. However, realize that we can't send you information about the outcome. We can't contact you if we need more information to service your complaint. So, we will not reveal your name to the employer. If you want information, just tell us that you don't want to be revealed, and we'll keep your information confidential. And we'll send you the results. Next. Let's just kind of just buzz through that real quick. Like, we just need to know that enough information that a hazard exists. Okay, next. And then just glance at that real quick, like, and it'll go on. If you want, next. And you can just see, where the hazard is located, how many are exposed to it, what chemicals are being used, who could be affected that's nearby. Next. Has anyone become sick? Do they have symptoms? Has anyone seen a doctor? Next. And we can go here if you want to, Bethany, or we can end here. It's up to you.
We can end. You did such a good job summarizing all of your slides so quickly. Thank you very much. This was just a reminder that OSHA does have a general duty clause. Even if there isn't a specific standard about something, they can, like a heat stress issue, OSHA can still support workers' concerns about those types of health issues. Okay. Thank you to all the speakers. And I know that Eduardo has been busy answering questions in the chat. There's too many, I think, to cover, but I am going to pull one for OSHA and then switch over, I think, to some questions for the CDC. So one, I think, really good question here is, someone Peg wrote in, it is my understanding that the small employer exemption, as opposed to the small farm exemption, only precludes OSHA from conducting general scheduled safety inspections, not investigating complaints or fatality inspections. The small farm exemption exempts these small farms from all OSHA coverage, all standards and enforcement.
That's pretty much correct. I just centered today on the farming operations because that's what this is about. But yes, it does get into there, like the low hazard industry. Can you exclude them from programmed inspections, things like that? And then also, there's certain things we can do, like the small employers and construction companies. It's just a matter of you have to dig into the appropriations directive and look at the low hazard tables to determine, their classification, and then go from there to see what we can do for ocean inspection activity and citation issuance.
Well, thank you. Okay.
Oh, and I will also add to that, in the appropriations, there's a lot more safety type citations can be exempted, but in many cases we can take any action with regard to health conditions.
And like a lot of us know and saw during COVID, that it varied a lot state by state, how different states interacted, different health departments and everything. So we have a lot of variability here in this country. Another really good question that I like, because I think this summarizes what a lot of folks want to know. Gabriella wrote in, I worked for the migrant education program. We work with families and students. What's your best recommendation if we know that our families got infected, presumably with bird flu? Do we need to report this to the health department, or what would be the best thing to do? That's probably a CDC question.
I'm sorry, please, could you repeat the question one more time?
Certainly, yeah. Gabriella works for the migrant education program, works with families, farm worker families and students. What's your best recommendation if we know that our families got infected or presumably got infected with bird flu? Do we need to report this to the health department, or what would be the best thing to do?
Yeah, I think so. I think it depends on your local situation, I think. And so I think the order of operations is tell your people you work with, and then reach out to your provider, or if the farm has a provider that is on retainer for the workers, then that would be the next person. And then right away tell the health department, the local health department. It really is engaging both, because you need a clinical provider who may be diagnosing you, but you also need to know your local health department, because they may put actually their own providers and provide antivirals out of their own stockpile. And so it really is dependent on local jurisdiction. The country it's a huge country in each county is a little bit different. So I'm sorry that I can't provide you a more facile answer, but the important thing is that if you are affected, that you communicate to your provider, and that the public health folks that are in your local jurisdiction know as well, and they can work as a team then to protect you and to protect your loved ones or your contacts. And I understand from the chat, I understand some people, a colleague from Wisconsin, for example, cautioned that this is not seamless. Some of the people who are affected are some of our most vulnerable in the community. They may not even speak English. They may not have a provider. It's complicated. It's not seamless. But that is the route. You get your provider to you contact the provider. You contact your local health department, and between that, you can get treatment and follow up. It's the route to go. That's what I would do if it was my family who was affected.